is Lee. I am a medical assistant that's going to be taking your history and vitals. How are you? Good, good. What's bringing it in today? Okay. So your prior OBGYN put you on pills to help with periods, but it's not helping your pain? Okay. You've tried a few different ones? Okay. And how long have you had painful periods for? Most of your life. Okay. So I take it pain medication doesn't really work? No? Okay. Did you ever get any further workup, any imaging, like an ultrasound or infection screening? Maybe infection screening, but nothing more than that? Okay. You've painful intercourse as well, and has that been an ongoing thing? Okay. Now, do you ever get pain when you're not on your period? Sometimes. Okay. Okay. And this is something that you've been dealing with for years? Okay. Well, you came to the right place. I'm sure Leanna the PA will, help figure out, your concerns, and we can finally get to the root of the problem. For sure, for sure. All right. I was taking a look at your new patient paperwork to confirm no medical history that you know of, and no surgeries. Looks like you're a social drinker, but no marijuana or tobacco use. Okay. No family history that's pertinent. And then looks like you are active, uses condoms, kind of been with the same person for a long time. Yeah. Yep, I saw that. Okay, let me do your vitals real quick, and then we'll kind of get you going. I'll sort of explain what we're gonna get set up with, okay? Awesome. All right. Well, blood pressure first. Do you have a preferred arm? That one's fine. Okay. Let's put some hand sanitizer first. My day is going great. Thank you for asking. All right, I'm gonna wrap this around you. Your blood pressure is good. Yes, absolutely. And by the way, if you aren't comfortable with anything that we are planning to do today, you just let us know and we'll find another way. For sure. All right. Are you having any COVID-like symptoms, flu, chills, loss of sense or smell or taste? One thing I actually forgot to ask, anybody in your family with a history of PCOS or endometriosis or anything like that, fibroids? Not that you know of. Maybe your aunt on your mom's side. Okay. I'm gonna have this go underneath your tongue. All right, that nose job all checked out. Temp is good. Okay, so here is what we will plan for. I'm going to step out, and then when I step out, well, first of all, I'm going to leave you with a cup. Now, whenever someone comes in with chronic pelvic pain, painful intercourse, we do like to screen, like do an infection screen, just to rule out conditions like PID. So we're just going to screen for gonorrhea and chlamydia, if that's okay with you. Yes, we can get that off your urine. So what you'll do, you'll go in the bathroom, leave me the sample. You don't have to wipe or anything like that. You'll close the container and you'll leave it on the counter in there for me. And so we'll do that, and then when you come back in, if it works for you, we're going to have you get undressed, waist down, everything top-wise can stay on, and then Leanna, the PA, will probably want to do a pelvic exam with a speculum. Have you had one of those before? Okay. All right, so you're okay with that? All right. And then she will do the pelvic exam, and if she can't find any obvious findings, she may even want to do an ultrasound real quick just to see if there's anything that she sees with your uterus or ovaries that maybe we weren't able to necessarily feel during the pelvic. That's okay with you? All right, I will let Leanna know. So with that being said, I am going to get out of here for you. I will leave you with this urine cup. You're just going to take it to the bathroom over there, and then Leanna, the PA, will be in for your exam. My pleasure. Nice seeing you, nice meeting you, and I wish you the best of luck. No problem. I'm coming in. Hello. It's very nice to meet you. My name is Leanna, and I will be the PA doing your assessment today. Lee, the medical assistant, gave me a little bit of background. She told me that you've been on birth control pills, but they haven't quite managed your painful periods. Yes, as well as the pelvic pain outside of your period cycle and the painful intercourse. All right. Well, we are going to do a full workup for you today. If it is okay with you, I would like to start with the pelvic exam, where I take a look on the outside, I use a speculum, and I look inside, and then I do an exam with my fingers. Would that be okay with you? All right, thank you so much. Get you situated. Do you mind scooting down a little bit more for me? Perfect there. All right. We are going to start with the exam on the outside, so you're only going to feel my hands on the outside. Perfect. And no pain when I'm touching here, right? Good. All right, outside assessment is normal. I'm gonna grab a speculum and put some warm water on it. Perfect. All right, now we will do the pelvic exam with the speculum. All right, you will feel my hands here. Take a deep breath in for me. Cervix looks very healthy, no signs of abnormal discharge or polyps. All right, I am going to take this out. You're doing okay so far? Next part of the exam is when I do it with my fingers to make sure that I don't feel masses, and you're going to let me know if anything I do is tender. Okay. All right. You're going to feel my hands now. A little bit tender. Okay. It's pretty uncomfortable. I am all done. with that portion of the exam. I'm going to switch gloves here. And if it's okay with you, I actually want to get an ultrasound to see if there's anything, you know, regarding the uterus or ovaries that we're missing. That's okay with you? All right, perfect. Just looking for some gloves here. Now today we are going to be using a transvaginal probe, which is the ultrasound probe that goes inside of the vagina. Are you okay with that? And would you like to insert it yourself? You'd rather me do it? Okay. All right, well, let's get you situated. All about communication, so you let me know if you're in too much pain. Let me get you this broom stress ball. Okay, that is for you. There you go. All right. I am just going to put your information into the ultrasound machine. Looks like we are ready. Do you want me to sit you up a little bit, or are you okay where you are? Okay. Alright, this is what the vaginal probe looks like. Alright. Let's get this set up here. Alright, you are going to feel some pressure now, okay? Alright. You're doing real good, okay? Alright. Sorry, I know it's not always comfortable. Need a couple more images. Lee was telling me either maybe a maternal aunt with endometriosis. Yeah, I was just kidding. All right, I am ready to take this out, okay? Coming out. Printing. All right, let me grab. Let's see here. You doing okay? Good, good. How about I have you get dressed, and then me and you are going to talk about the ultrasound findings and what our next steps are. For sure. Okay, I will give you some privacy, and I'll have you get dressed. My pleasure, my pleasure. You doing okay? Good, good. So, based on your history, your personal history, your symptoms, as well as your family history in the findings today, I do have a very high suspicion for you potentially having endometriosis. Right. Are you familiar with the condition? Not so much. Okay. Let me kind of show you. So, as you know, naturally we have our uterus, and every month that inside lining of the uterus, or the endometrium, sheds off, and that's how, you know, we get the menstrual blood coming out. And so basically with endometriosis, you have tissue similar to our endometrium or the inner lining of our uterus. You have it outside of the uterus, whether it's on the ovaries or on the tubes or any essentially other places in your pelvic region. Now, what is the problem when you have similar tissue outside of the uterus is this tissue is doing what the endometrial tissue is doing every month, which is shedding that lining. And so when you think about it, when we shed our lining naturally, there's a way out. It comes out of our vaginas. But what happens to that similar tissue that's also shedding every month? It has nowhere to go, which causes a lot of inflammation in the area or the pain, scar tissue formation. And so when these things happen, they can happen in various stages. People can have, minimal stages or more severe stages. Now, the only way to diagnose endometriosis with 100% certainty is through a procedure called a laparoscopy that's done in the OR. And that is when cameras are inserted to take a look at your pelvic cavity and to sample any tissue seen outside of your uterus to test for the endo. Yes, exactly. So some people will say that they have a history of endometriosis, but and a lot of these people are people who had laparoscopies done. So in your situation, when you've had the history of painful periods and painful sex, when pain medication didn't help, birth control did not help, I would say the next option at this point is to definitely do a laparoscopy to take a direct look at your pelvic cavity. Exactly. And so what I am going to do is I am going to set you up with the doctor that would be performing the procedure, and then you'll do a pre-op consult where they explain everything that goes on during a laparoscopy, and then we will get that scheduled for you. Yes, yep. There are some instances where if there's a lot of scar tissue, they'll remove it at the time of that procedure, and they'll go more into detail with you on that next appointment. Right. And so with that being said, the ultrasound that we did came back normal. And this is a very important thing to note, is many people have endometriosis and don't necessarily know, because when they get ultrasounds, they won't always come back abnormal. There isn't necessarily a definitive way of saying yes or no to having endo just through an ultrasound alone. So your ultrasound came back completely fine, but again, that doesn't necessarily mean that you don't have an inflammatory process going on internally. Exactly. So exam-wise today, there was no structural anomalies, there were no cysts, no fibroids, and so at this point, with how long you've been having these symptoms for, we're going to plan for the laparoscopy. Yes, absolutely. So I am going to go get you set up. I'll put an order in for you to see the doctor, and then we'll get you taken care of. Absolutely. My pleasure. It was nice meeting you.